But then you look at these people and say, can I in Peterborough, afford to lose, 10 nurses? No, not really, right? Not a single service in Canada, right? We can't even get a family doctor in our region, right? It's a farm community.
Our medical system was already disastrously understaffed.
Right. Understaffed.
Yeah. Anyway.
Yeah. And the truth is in independent, discussions, people talk about that equity, the benefits and burdens fairly distributed. Well, really, no. Penalizing stressed healthcare workers, denying accommodations. We are accommodations, equity. No, these people are treated like dirt, even after decades of service in their profession. And then it's just not coherent because other policies and values, presumably that, I haven't lived in Canada for that long. We moved here in, for good in 2018. So it violates principles of informed consent, transparency, patient care, centered care. So we do have limitations, as I said, a convenient sample. We just counted on whoever wanted to take the time to answer our survey. But that's true of all surveys, by the way. I mean, it just doesn't, there's only one poll that I was able to identify by Ipsos done across Canada of health workers. It's a very interesting one. And by the way, they also relied on a convenient sample. Whoever bothered to answer. They just have more, a greater power arsenal to recruit, about 5,000 and some, right? Self-selection bias, maybe. People who responded to a survey, it actually asks them about their views rather than why they're vaccine hesitant. It may be a self-selection. But we could say that of the opposing view that only recruits people who are, sort of kind of, right, supportive of the policy or misconstrues their responses as being hesitant for some kind of psychological quirk rather than some valid reason. Predominantly unvaccinated sample, we talked about that. Descriptive statistics, I'm not planning to do some causal analysis, and I don't really think it is important to the conclusion anyway. And then, self-reported data, that's a problem of every survey. So I just have to state them in a, professional way when I publish my work. So the policy implications, well, it failed. In my opinion, I measured it. So I would challenge someone to come with the same instrument. It's an external instrument, OECD, and measure the results of the policy. Is it a failure or is it a success? I think it's a failure. And also, I think that we are challenging with all the body of work, the dominant portrayal of hesitant healthcare workers as irrational, misinformed, conspiratorial, and right-wing, right? So in my youth, it was being left-wing that was the issue to be attacked. So, my groups, my friends, etc. But of course, I lived under a military dictatorship back in Argentina when I was growing up. So, so whatever construed you as. So, it never occurred to me that you could do exactly the opposite with every single, of these, persecution strategies, right?